la civiltà dell'amore. Fratelli e sorelle, costruite senza stancarvi mai questa civiltà. Lavorate per questo, pregate per questo, soffrite per questo.
Good afternoon and welcome to the 43rd meeting, l'amicizia tra i popoli. Today we're talking about pediatrics, a very challenging title. So do we still need the pediatrician? Pediatrics between health and reforms. We're here together with three very important guests that I'd like to introduce immediately. Let me start with Antonio Davino, President of the Italian Federation of Primary Care Pediatricians. So thanks for being here with us. Alberto Villani, Director of the Department Emergency and General Pediatrics of the Hospital Bambino Gesù in Rome. Thank you for being here with us. Last but not least, a very young colleague, Nicola Gobbi, General Practitioner, Doctor for Continuity Healthcare Services. He also worked for the emergency in pediatrics at the Hospital of Rimini. Thanks for being here with us today. So we are now facing a very challenging period for the national healthcare system for our country. There are very important things happening, and the first important thing that I'd like to share with you is today is 1.2 children per woman, and the last report that has been published focusing on this aspect. And the national system needs some organizational model, some new organizational model in order to build a future and to develop a future. So it's very important to underline the fact that it's still underfinanced and not financed enough. So for you, what is the future of the pediatrics within this context? Antonio, I'll leave you the floor. Thank you. And thanks for this invitation. I think that the opportunity that we have today to talk about such an important topic within such a prestigious context is a very important and unique opportunity, because we have the opportunity here to talk about the future of pediatrics and generally speaking about this topic, which is pediatrics. I am a family pediatrician, and together with the general practitioners, we are part of the primary healthcare system. And the primary healthcare system is a system which has been created in December 1978 with the Law 733, which created the national healthcare system. And let me say that after 44 years, many countries have tried to copy from us this revolutionary law, which has many positive aspects, because it replaced the model which was based on all a series of approaches and methods of support based on criteria which were not very well balanced and equal. So with the 833 law, this is overcame, and the 833 law is basically focusing on the equal aspect and on the healthcare system for everybody, which is a right which is stated by the 32nd article of our Constitution. And I'd like to start from that point, because we need to keep in mind that after 44 years, so a huge experience, that we had to face many very important things. We recently had to face the COVID pandemic. Unfortunately, there is a war, as we know, happening, and the economic situation, which is not very good, and many other aspects that are becoming more and more challenging. And within this context, I think that we need to focus on the three principles of this law. And of course, this should be renewed, because it's very important to understand and realize that it's fundamental to keep on guaranteeing to everybody, so from the north of Italy to the south of Italy and the islands as well, to guarantee to everybody the same opportunities despite the situation of every people, the same opportunities to have the same kind of access to the healthcare system. So we are here dealing with two different aspects which are peculiar. So on the one hand, there is the health relationship, which is a relationship that we have with the families. And I rather prefer to define myself as a family pediatrician instead of, let's say, the so-called free choice pediatrician, because we have a real relationship, which is not just a health relationship with the family. We are developing a dialogue, a real dialogue with the people of the family of the children we are treating, and explaining them all the problems and issues. And also we shall consider the treatment period and the communication, which plays a key role within this context, because this is within the basic conditions and aspects of the Law 833, which is basically the opportunity of the person, of the parents, to choose the pediatrician for their family. So to guarantee to every minor or to every children or adolescent, to guarantee the presence of a pediatrician, and this is just a starting point at the basis of the relationship that we have with the family. So this agreement, this kind of contract that we have based on trust, on the real trust, is the one of the pillars that represents a starting point also for a renewal for the future within a context, as Dr. Altini was saying, of the recent Decree 77, which has been published on the Gazzetta Ufficiale on the 22nd of June. Alberto, I'll leave you the floor. Thank you very much for this invitation, because we are talking about a very important topic. The title of the meeting is A Patient for the Person. Here we're talking about children, and of course Italian pediatrics is a very important aspect within this context. In Italy, this plays a very important role, and of course I'd like to talk about the specific and peculiar aspects of the pediatrics. When we talk about the perspectives, the future of the pediatrics, well, unfortunately, in our country, we are not focusing enough on children and on their age. And I'd like to thank Professor Altini for this meeting, and because we often don't have the opportunity to talk and discuss about this context and this topic. Let me quote just a few figures. Maybe not many people know that when we have to deal with some diseases, which are the oncological ones, pre-adolescent persons, people, when managed by the pediatricians, are more likely to have a better result and solution and treatment of their disease. And this is true for all the fields, for all the diseases. And the other important and specific aspect of pediatrics is that this is an aspect which involves the child 360 degrees. So what is the future of pediatrics then? Well, we hope that it's going to be a very positive future, but we have to consider as well that there are some set figures and some set data as well, which were named at the beginning of this meeting by Professor Altini. Well, the birth rate is dramatic in our country, because the National Institution for Statistics in Italy every year states that the situation of the birth rate is dramatic in our country, but nothing seems to be made in our country. We have less than 400,000 children born every year, and the trend of that we were focusing on the past was even optimistic because we would have never expected such a low birth rate. So from this point of view, we can say that pediatrics doesn't have a real meaning if we don't take this situation and this data into consideration. So there are, of course, a lot of examples that we can make. So the birth rate and the fact that also when new people, new cultures are joining our country, coming to our country, so also generations of people coming from a background where they used to have 2, 3, or even 4 children in their family. After the second generation in our country, the birth rate decreases immediately. So that's a cultural aspect. And we as pediatricians, we have been trying very hard to explain and to talk about the seriousness of this issue, as this problem. And it's important, in my opinion, to talk about that aspect also from an educational point of view, to focus on schools and classrooms with children in order even to protect the families themselves when the problem of children is concerned. Because I think this is the real issue, because we keep on planning and programming, but if we keep on going on with this trend, of course there is the passion for the person, but if we don't have the passion for children, we will no longer have the passion for persons and for adults. Nicola, what are the risks and the perspectives for this path for you and in your opinion? Well, I'd like to thank all the organizers of this event and thank them for having invited me here. Well, my working experience is kind of limited so far. I just finished my studies 4 years ago, and I started with a specialization in as a general practitioner, and I had the opportunity to work at the Pediatrics emergency. So I have this overview of the as a general practitioner and of the medicine within a context which is basically modified, which has been modified by what happened since 2019. So the COVID pandemic basically modified our approach, our way of thinking, and our way of working as well. And within this context, if on the one hand the adults basically had to face physical direct consequences of this from this virus, we shouldn't underestimate the indirect effects on the children as well. There's been an important increase in the hospital from conditions which basically do not have an organic basis, but that are based on anxiety, basically, from these young children, young people that are living a very particular period of their life, because we know that they are living a transitional period and they have different needs according to their age. And we also saw an increase in the chronic diseases as well, so overweight and other kind of diseases on which we shall focus. And in order to be able to do that, we need to get back to the real relationship based on trust and direct relationship between the doctor and the family of the children, in order to be able to recover the educational role that the pediatrician plays, which shall be at the same level of, in my opinion, of the family and of the school, in order to be able to create the most favorable conditions for the psychological and social development of the child within the society. So in order to be able to do that, pediatricians shall be able to become protagonists within the society, as it is the same for adults with general practitioners, because that's the only way we have to win this challenge, to face and win this challenge. And we need to be able to recover also the so-called physical relationship with the family and with the children, because of course we can rely on new technologies, but all what is part of the verbal and non-verbal communication that is fundamental for the interaction with the child is essential within a care system. So I hope for the future that we shall be able to achieve this goal, but of course we need to rely on a good organization and as well on a good and proper training, because without those aspects it will be impossible to achieve these goals. Thank you, Nicola. And starting from what you just said, and as Mr. Balduzzi used to say, I'm here playing a very important role. So let me say, we have very specific and well-defined departments. So when we deal with the management, we have the hospitals, the territorial aspects, or the specialized doctors in their cabinets, or other kind of resources. But in my opinion, they are all professionals that have the same skills, but in the reality they are very structured in a vertical way. So the question is, Antonio, can we start working together despite contracts, despite what contracts say? What can we do from this point of view? Well, of course, we can start working together, and this is an important stage from which we can share this concept. We are all playing in the same pediatrics field, and I think that it's very important to start talking to each other within this context. We talk about the integration between hospitals and territory, and we've been doing that for decades, but this never happened. And too often, with the politicians, we have this dialogue and this debate to create this pediatrics field, this pediatrics area, because we really believe that we as pediatricians, we are taking care of children and adolescents. And what the director Altini was saying is very important, because in my way, this is the path, the good path to go through. And this is a very important pillar, in my opinion, which comes from the relationship that we can start develop with the family from the very first day of their children. So from when a child is born till 14, 16 years old. So we believe that this is a kind of a privileged relationship that we have, and that's the only approach that the pediatrician shall have, because of course our friends from the hospital, when they have the opportunity to visit the child, they just treat a specific disease. Of course, this is very important, but maybe they will no longer see that child in the future, while the pediatrician, the family pediatrician, since the very first days the child is born, starts developing a very important relationship, a very strong relationship with the family, and they keep on developing this relationship until the adolescence. So that's very important to rely on this trust, which is again stated in the Decree 77, which is a pillar for all of us. And let me also add a couple of remarks. We all know that this decree focuses on some funds for what we can define as of the entire field, so the community hospitals or the local centers, local health centers. But one of the main issues is that the resources and the costs for the health operators still haven't been well established and defined, or just a little part of these funds have been allocated for that. So we need to work hard all together in order to achieve this goal, because if we want these local centers to actually succeed, we shall rely on some data and figures. So 70% of the Italian municipalities accounts for less than 5,000 citizens. So the associations all through the country, being able to create and strengthen the quality level of these cabinets, well, this means being able to visit and to take care also of patients of some of our colleagues, but also to make the diagnosis from your own cabinet, and to take care of this and to focus on this process, which can actually become a real theoretical process. So I think we shall focus on this aspect and strengthen this point. So what shall we need here? And it would be nice to have the opportunity to discuss and debate about that with some of the decision makers and the politicians. So the first thing I'd like to ask is, please consider what people working at the local level actually tell you, ask you, because they are the people that every day have to face these issues. And if you don't take into consideration these aspects, your project will finally fail. And I really want to thank, because I'm happy we are here to talk about pediatrics and talk about family pediatrics and to talk about a review of the national healthcare system, which shall and must rely on the best practices that we developed over the last 44 years. And let me conclude by saying that our work shall be more and more focused to be strengthened on all the aspects concerning prevention and the development of good lifestyles. And we shall focus on vaccinations as well, vaccines, and make sure that we can increase the number of people that get the vaccination. And we need to work in this direction, and we need to be able to work properly towards this direction. So this means working hard to allow these associations, these working groups, these pediatricians to rely on the needed supports, allowing them to get back to be doctors and not just spending the majority of our working hours just taking care of bureaucracies and all those aspects that, for a doctor, in my opinion, shall just represent a minority, a little part of our working time. And let me conclude by saying that I think it's important to keep on working in this direction. Let's talk to each other. I kindly ask the politicians to take into consideration these aspects, because I think that if we all sit around the same table, each one aware of his own role, we would be able in this way to succeed, because unfortunately today we still have some agreements in place that kind of limit this interaction. So we need to go beyond these collective agreements and share the same paths, share the same plans in order to achieve together this goal. So focusing on the child at the core of our work.
Alberto,
which way can you imagine to work together in a more structured way? Well, focusing on the child. Children remain the same, regardless of those taking care of them. So it is necessary for the situation that we have been experiencing, the national healthcare system and the organization that was conceived over 40 years ago is something extraordinary. And indeed, when it was designed, it was in the vanguard at that time. But even the best things that were done 40 years ago were profoundly reviewed. And I think that the time has come to revise profoundly the healthcare when it comes to children, trying to bear in mind that we need to focus on specificity, and we should avoid imitating in a bad way what happened in the case of healthcare for adults. Medicine was disgregated, and it is no longer holistic, and it was detrimental for the patients, because in the end, we have difficulties in identifying those who should deal with what. And in this regard, we are in a vantage point, making reference to what the colleague said earlier. We should keep the professionalism of pediatricians as high as possible, and all the colleagues working on the territory are extremely valuable. The pediatrician is a specialist in pediatrics. And this is an element which is the founding element of our work, and this is linked to the need of children to have a specialist at their disposal. We know that there's an increase in the number of children with chronic conditions, and these children have enormous difficulties when they are dismissed from the hospital and they go back to the area where they live. So we need to have an exchange of views. We need to work a lot in this respect. Then if the question of the director is what is the pediatrician's dream, my own dream, after working for so many years with such enthusiasm, and for the moment, I need to add, unfortunately, for the moment, each child has a right to be taken care of by a pediatrician. My dream is that of having pediatricians able to face any possible situation and able to work in every possible context at the highest level as possible. But I think that from the point of view of the organization of the system at territorial level, we should focus on the future, the medicine for the future. And to do this, we need to invest on facilities, at least at local level, and some important steps are being taken in this respect. Another fundamental aspect is reducing, in general, the load when it comes to red tape. I worked as a general practitioner and a free choice, pediatrician, and especially over the last 2.5 years of the pandemic, the majority of criticism came because of the not because of the level of professionalism of physicians, but the sense of frustration and feeling powerless, because pediatricians have to spend a lot of the time dealing with bureaucracy. So in a sense, we should look for the right ways to strike a balance between our everyday work and the red tape. We should integrate more and more several figures within the territories, and we should also try and create moments to share views in order to increase the cultural heritage that we have, our knowledge, and we should not disperse, we should not waste resources. So group medicines should not only be places where resources are shared, but also places where ideas are shared. They should become education-related spaces in order to coordinate the work of the various physicians, in order to create an exchange of experiences and views among all the specialists, all the physicians. In Italy, we have a fiduciary relationship, which is one-to-one. It is not very easy for families to understand the situation, but certainly we should work so as to have a more balanced load between the various specialized physicians in order to have more tools and be able to act more effectively and getting back to focus really on the child. So we will certainly need a better channeling of investments, of resources, and as much as possible at territorial, local level, we should create a greater uniformity in order to avoid imbalances which then lead to problems when managing a hospital within a specific area. So you give me the opportunity to get deeper into the multidisciplinary approach. We study in order to have our own practice and work alone. This is the history of the training as a physician, but the medicine of the future is not this one. No one alone can respond to all the needs of our patients, the beneficiaries of our services, the reason why we are working as physicians. The question is, do we really believe in group medicine and multidisciplinarity? Are we available as pediatricians based in the communities to introduce ourselves in a system in which, due to the accesses of children, are we ready to play this game all together so that hospitals also become more sustainable? Absolutely. We not only strongly believe that multidisciplinary approach is one of the key principles, and the Ministerial Decree number 77 and the National Resilience Plan also focuses on this, not only working as healthcare professionals, but also working in line and together with other professionals, which are equally important for the good results in the end. I believe that this is the future, working as an association, working as a group. Of course, we do need prerequisites. First of all, networking all the associated professional practices, which should become spaces where we have a reference community house, a hub, which envisages several interventions for higher healthcare activities in order to avoid inadequate hospital admissions with white codes. We should create a filter system in the territory, and this can be done following the dictates of Ministerial Decree number 77. The number of hours of the facility identified as several facilities uniting several family pediatricians, well, the number of hours availability of pediatricians has already increased. We will increase the number of hours as an aggregate, as an association, as a group of pediatricians, and so the citizens and the legal representatives will have more chances to find a practice which in turn should meet several requirements. I always focus on the increase of the qualitative level, because this is the only way to avoid improper hospitalizations. We should provide a good response at territorial level, and associated practices should become high-quality practices. I would like to go back to the financing levels of Ministerial Decree number 77. The fear is that the financing levels will be totally insufficient to guarantee a reorganization of the territorial healthcare system. So the real problem in this respect is that this cannot lead to a privatization, which would be unacceptable to us. We should focus and guarantee pillars, an equitable, universally available healthcare system, guaranteeing healthcare to everybody, with no exceptions. So we are against a privatization of this kind of healthcare system. In some cases, some activities were outsourced, so we should be very careful, because outsourcing activities and what may lead to privatization should be looked at very, very carefully, because unfortunately this could lead to an increase of inequalities, which are already evident today. So we should be careful to focus on the healthcare system of the future, of the next 40 years, and we should start from assumptions which were very important in order to guarantee the same care, even health care, to all the Italian citizens. So I would like to say that we should move, and we should continue to move in this direction, but we should also try and agree all together several ways to proceed so as to guarantee all the prerequisites which are fundamental. Just to mention one, the fiduciary relationship should continue to exist, because this is the basis of the healthcare relationship between the family and the pediatrician of free choice. If this relationship continues the way it is existing today, we may have some advantages. The Italian census highlighted in several surveys that the family pediatrician and family general practitioner are valuable figures for the patients. We managed with our activities to reduce the number of hospitalizations. We worked so that, and I agree with Alberto, the pediatrician is a specialist physician. So we are dealing with a specialist, and the specialist, with his or her activity, reduces hospital admissions, guarantees health care for all children from their birth to their age of 14 or 16, and they manage to deliver to the healthcare for adults safe and healthy adults. So this is why we should all work together, and we should all focus on the conditions, as my colleague mentioned, obesity, overweight, diabetes, all conditions which today are conditions to be tackled so that all the kids become healthy teens and healthy adults. And the decision makers should also focus on the fact that having a healthy adult means having a person, a citizen, who will not be a cost for the healthcare system. A kid suffering from a chronic condition will certainly be costly for the healthcare system. Thank you very much. Well, getting back to your question, how should we integrate it? Well, I think we should reflect on one aspect, the speed of progress which is being made by medicine. Medicine is making progresses in a faster way than we may think, and it advances more rapidly than decision makers may think, and we should be ready to make proposals, and I hope we can find real opportunities for collaboration. Many of the participants are probably colleagues of ours, and they certainly know that many conditions that were considered impossible to heal in the past are now able to be healed. They can be cured now. In many cases, conditions that were not easy to manage in the past have become more easily manageable. But this requires multidisciplinary approaches and the awareness that the individual physician cannot deal with a specific condition by him or herself. We should focus on the current law, and we as professionals, since decision makers are very slow in their decisions, and I would like to stress to my friend, dearest friend Antonio, we in hospital, we have been accustomed to work with less people that we need, and we are accustomed to inventing solutions. So we should share the most important heritage, the professional heritage and the human heritage. So being able to share all these aspects, it is important to have a tool, it is important to have technology, but the real heritage are the professionals. The more we use professionals in the best way possible, and the better it will be for the patients, for the children. If we do not take into account, and if we reduce the possibility to have a real contact, because imagining a genial intuition, the pediatrician in his practice, well, that pediatrician 40 years ago could have an update every 5 or 7 years. And today, this is no longer the case. You need to have an update every 3 months, 5 months. Otherwise, you will lag behind. So integration is no longer a wishful thinking. It has become a need, and we are already lagging behind. I totally agree with my colleague. Going beyond all the aspects related to the rules and the laws, the fundamental elements are made up of the training and constant updating. Without these elements, we will not be able to overcome this stalemate. And I can make a comparison with my training course in general medicine. In the current situation, there is a shortage of general practitioners. We all know that. And this is why several solutions were found in order to make up for this shortage, enabling physicians in training courses to have their own patients. But this element should be managed with a high degree of equilibrium, because professionals, some young professionals, are just beginning to work, and they should have their own training and updating periods and moments. This is a heritage which cannot be guaranteed in the future. I do not know the details of the schools for specializations, but I hope that the professionals who start to work on their territory would have been properly trained, because our job is very specific and it cannot be interchanged. And we should forcibly integrate our work. We should try and find moments every week or every month or every 2 weeks to share our views on several aspects, so as to create a common substratum. And then in addition to that, we will certainly have to be accompanied by curiosity, by personal curiosity, to go beyond our limits. And we will have to try and offer our best knowledge and best skills to the children and to the adults. Well, we have wisdom, but also a young based approach. So this is the first lesson of Montreal. So you should prepare what comes after you. Are we preparing what will come after us? Are we thinking about the future generations? And are we thinking about creating the conditions so that future generations can win such a difficult challenge?
Well, I would answer that some wise politicians over the last few years started increasing the number of internships and funds for students. But if we did that before, we wouldn't have reached this point. Let me explain it better. Over the last few years, there's been more than 1,000 funds for pediatrics, and they've doubled or even more than that over the last 3 or 4 years. So what does it mean? It means that over the next 5 years, we should no longer have the issue and the problem of pediatricians. The problem could be there over the next 2 years, 3 years, maybe 1 year. But the problem, the fact is that when in 5 years' time we will have 1,000 more pediatricians in order to face the territorial needs and the hospital needs, all these needs will be completely filled. But the problem is now. And it's important to focus on what we do for the future. We actually implemented a series of activities. We started working with the directors of the 37 directors of the schools of specialization in Italy. And as you all know, the specialization in pediatrics takes 5 years in Italy. So there is a general 3 years period, and then the 4th and 5th year are focused on research, so either research within the university or within the hospital or the territory. So we asked for all our colleagues to know what is actually done on the territory at the local level, and they can only know that if they actually live this experience. So being actually involved for 2 or 3 months within this context, so during the 4th or 5th year of their study, and during this period, maybe even for a higher number of months, because we have an organizational structure which is different from hospitals and from the university. So the first key point is the knowledge of the local area, of the territory. So we shall allow all our colleagues that are studying for becoming pediatricians to know what the family pediatrician is doing. And then we shall focus on the new generations of pediatricians, and we, as Italian Federation of Primary Care Pediatricians, we have been working for a few years already on this transition, aiming at focusing on this fundamental aspect, which is basically creating the ability to create the a network of professionals developing and having our same passion and devoting and committing for the same amount of hours as we are doing on this job, on this work. So, of course, we can improve this aspect, but already we are working with some scientific activities involving some trade unions as well, and involving many of our colleagues aged below 45 years old. So young pediatricians involved to work within this field. And it's very important to work within a university field on the training, because they shall know what are the perspectives and the context of the local areas of the territories. And let me say that these experiences can really enrich these students. They are very smart, they are very digital students, and they have access to a huge amount of data. And they are kind of an incentive for us as well, because of course we receive more than what we give to these students, and I believe that these are virtuous experiences that shall be replicated all through our country. So it's important to make sure we rely on the same procedures to allow all students to know what the family pediatrician shall do, because I think we are doing the most beautiful job on the world. I will never change my job and my work with anything else. Alberto, what do you think we can change for the future? Well, if we think to the next 5 or 10 years, well, let me say, first of all, that 5 years ago, I would have never imagined the present situation. And already 5 years ago, the situation was very challenging. However, of course, considering the peculiarities of the generations, the political context, and considering the entire framework in which we are working, well, the dream would be to achieve over the next 5 years a completely different system where the patient shall be placed at the core, with all a series of professionals, not only pediatricians, but all a series of professionals creating a network around the patient. So we shall be aware that childhood shall be, of course, dealt with by pediatricians, but we need to develop a real culture of childhood, focusing on children, working more within the school system, and keeping in mind that it's not just a matter of figures and data, because if we have 400,000 children, this is not just a matter of children, it's a matter of that. The fact is that we have less women as well, because the past generations were the result of the so-called baby boom, so people born between the 50s and till 1965, more or less. So now we have less children because we have less mothers as well. And it's not just a matter of figures, because Antonio knows that the increase in the numbers and of students in pediatricians is the result of the policies that have been developed. But let me say that 37 schools to specialize in pediatrics, it's something crazy. We would just need 10, 12 specialization schools. So we need to consider the real world. And you perfectly know what I think, what's my idea. I really wish we'll get to a radical revolution of the possibility that we have to take care of children and provide them healthcare systems, because patients that we used to treat in the past are completely different nowadays, both at the local areas in terms of approach, of course, and in terms of the roots that this context has, based on the real diseases, because there is no disease that actually can be treated as it was in the past. Many of the diseases nowadays are due to the context in which we are living. So we need to review the approach that we have with the childhood from a cultural point of view. And in terms of pediatrics, as for the pediatrics, I think that the dream is that there should no longer be the hospital pediatrician or the family pediatrician or the community pediatrician, but the pediatrician as a point of reference, taking care of all children with a very high professional approach. This is my dream for the future. Thank you, Alberto. Nicola, I'll leave you the floor. Well, looking forward for all those changes, and I really hope that they will actually take place within this time framework. I believe that each one of us shall also try to understand if we are actually doing our best within this context or not. Considering that the organization and the context are not only relying on an individual, we need to make sure and be aware of the fact that each one of us can improve and understand where we can improve within a time framework, within this transitional period, and in order to achieve the best for ourselves, but also for our patients. So growing increasing as far as possible the cultural training, and trying to get back to the origins as well. So this is fundamental as well, especially within a context like the one we are living in today, where we are no longer relying on the same points of references. There are also social campaigns played by the medias at the national level, creating this kind of a wall which should be overcome. And in order to do that, I think we shall first of all think about ourselves and try to understand if we are really doing our best within our field. Of course, relying on professionals that will play a key role in order to achieve that ideal balance and interchangeability at the professional level. Thank you, Nicola. We still have just a couple of minutes each for the very last question, which is, would you still be a pediatrician? So from a personal point of view, according to your personal experiences, what made you choose this job, and would you repeat this choice? Well, I think I already answered to this question. Of course, I'll repeat my choice, and I'll be again a family pediatrician. I totally agree with Alberto when he talks about this new role of the pediatrician, and I think that this path shall actually require some years, and also a kind of a revolution in terms of law, which I don't know if it's going to be very easy to be achieved. So I think we need to keep in mind that we have a national healthcare system which is very good at the European level. It's considered to be very good at the European level, and the pediatrician is the only professional that can guarantee to the children treatments free of charge. So this is a very good starting point. We need to sit around the same table and discuss about the future, and talk about the future in order to be able to develop sustainable future methods, relying on the Article 32 of the Constitution, stating that health is a fundamental right for the individual and for the community. I totally agree with Antonio, and let me add that not only people who are born in Italy, but all children living in Italy can rely on this right. Well, the pediatrician is a way of being. This is not just a job. And of course, those people that decided to become pediatricians really believe in that. This is not just a job. So being a pediatrician, I agree with Antonio, this is the most beautiful thing that you can do in your professional life. So of course, I would repeat this choice. But doing that nowadays, it's completely different from the past. But but it is the same also for other jobs, like being an engineer 40 years ago or working in a bank 40 years ago. So it's completely different. And within the medical and health field, this change happened very, very quickly. And I think that being a pediatrician nowadays is kind of more challenging, because it's very challenging to keep a very high professional level in terms of knowledge and skills. Nicola? Well, I didn't change my mind, and of course I'd like to go ahead through this kind of path, because as it's been said before, pediatrics is one of the very few realities where the doctor can actually have a kind of an holistic vision, both in terms of knowledge and in terms of understanding the psychological and social development of the patient, of the child, who is living a transitional period and who is completely and continuously evolving over the time. So being a kind of a guide for the family is, in my opinion, an honor and not only a job. So for me, this is a very important aspect, a very beautiful thing. And I think that this shall be done, of course, with the good methods, in the good way, relying on all possible tools and channels available in order to rely also on all the methods and the tools that we have, focusing on the person, because this is what we really need in this moment, in this period. Thank you, Nicola. So this evening we shall commit, because we said that there is an important collaboration space, so we need to open this roundtable in order to collaborate and overcome these borders between jobs and develop a real path for our young students that need to become future professionals. So once again, thank you very much to all our guests for this event, because the meeting is an opportunity to meet very interesting people focusing on very interesting topics. And please let me remind that outside our room there is the opportunity to donate and to take part in this initiative, so at an individual level, and this will allow the Meeting Foundation, which has been recognized as a player within the third sector, to keep on having this space to talk about very important topics. Thank you very much and wish you a good afternoon.
Complimenti, bravissimo.
Bravo.
Tutti come lei.
Grazie. Bravo. Grazie, siete stati stupendi.
Penso sia venuto.
Tutti insieme, sì. Esatto, i ragazzi al centro. Cazzo, faccio una brutta figura qui.
La civiltà dell'amore. Fratelli
Assolutamente.
e sorelle, costruite senza stancarvi mai questa civiltà.
Grazie. Scusa che ti ho fatto venire fino a qua. Sei stato...
Soffrite per questo.